Hello and welcome back. My name is Mr. Abbas Glory. So I want to welcome you back to this channel. And if you are new, kindly subscribe and hit the notification button so you'll be notified when other content are dropped. So going straight to what we have today, we'll have a question we need to attempt. The question says, the number one question says, the nurse attended to a post-op liver biopsy patient is expected to place the patient in what position? Liver biopsy, post-liver biopsy patient. Nurse is to place the patient in what position? Number one, left lateral, right lateral, supine position, and prone position. Which of these positions is best for a post-op liver biopsy? Let's hold on. Number two, the supervisor knows the nurse understands positioning when she places the patient with a diagnosis of air embolism in what position? The supervisor knows the nurse understands positioning when she places the patient with a diagnosis of air embolism in what position? Left lateral, we have right lateral, we have supine position and semi-Fowler position. Which of these is the best position? Let's hold on. The number three says, what position is the nurse expected to place the patient with cleft palate during feeding? Cleft palate during feeding. Left lateral, upright position, right lateral, and then prone position. Number four say, what position is the nurse expected to place the patient with cleft palate after surgery? Left lateral, upright position, right lateral, and prone position. Now, if you observe, this question sounds simple, but are confusing. For you to be able to understand what position to place a patient, we need to know what are the different positions that are used in nursing that will help us to be able to understand that if I see a question like this is the best way to approach it. So before I attend this question, I want us to go through what is positioning. What are the different steps, the different procedure, and how can I be able to know the right position to place a patient? So let's dive into what we know as positioning. What is positioning? Why do we need positioning? Now, patients are placed in different positions for different purposes. Patients are placed in different positions for different purposes. So one of the major reasons why patients are placed in position, number one, is that placing patient in proper position promote comfort and safety of the patient. When you place a patient in proper positioning, it promotes comfort and safety of your patient throughout hospitalization. So it therefore means that you need to place the patient in the right position that will help in proper management of the patient, because wrong position can lead to injury. And when injury occurs, it can lead to other problems. Number two, it promotes clear airway. It therefore means that there are some positions that will help promote airway clearance. So also there are some positions that will obstruct airway. So number three, it encourages circulation throughout the body. Yes, of course, we know that for circulation to occur, certain position needs to be avoided. It therefore means that if you place patient in the right position, it will promote circulation, or rather it will encourage circulation. Next, that it minimizes patient exposure during surgery or wound care. Now, in course of caring for a patient, proper positioning will enable you to expose the area that are only needed to be exposed. If you place a patient in the wrong position, you can end up exposing the patient as a whole. So these are some of the reasons why, or some of the reasons why it is very important to place patient in the right position. Now the question then is, what are the basic positioning that are used in nursing? Okay, one of the basic positions, rather, one of the first positions that are used, or we will talk about, is supine position. Supine position. So what is supine position? In supine position, the patient lies flat on their back. If you look at the image of the screen, discover that the patient is lying flat on the back. So when a patient lies flat on the back, referred to as supine. Then the big question is, what are the indications for supine? Number one, this position is used for post-surgery recovery. When a patient comes from surgery, this is one of the positions that is used for post-op recovery. Number two, is used for diagnostic procedures like X-ray, ECG, and all of that. And of course, it also helps to promote for rest and comfort. The patient, sometimes they use position for rest and comfort, probably after surgery, after some certain procedure, the patient is allowed to rest. And one of the positions that is used for rest is supine. Patient is seen lying flat on the back and then for comfort. So the next question is, what are some of the indication? We've known about the indication. Now, what are the precautions that we need to apply when using supine position? Now, one of the strategy of knowing supine is SU. So you usually call it facing up, facing up. So supine. So what are the precautions that I use? What are the precautions that we need to look out for in using supine position? Number one, you must use, not all condition, but sometimes it's encouraged, use pillow to support the neutral curves to prevent backache. Sometimes it's encouraged to use pillow on the neck so as to support the neutral position to neutral curve to prevent backache. And of course, you must also ensure you monitor the patient for aspiration in unconscious patient. It therefore means that supine position sometimes, even though it is used for rest, it can lead to aspiration. So you must be able to monitor patient for aspiration in an unconscious patient. That is why sometimes it's expected that while place patient in supine position, you should turn the head to one side. Why are you doing that? Is so as to promote drainage, or rather secretion from the mouth. Now, next thing is you must observe is another precaution is reposition regularly to avoid pressure sore. Because remember we said that it is used for post-op. So if the patient is unconscious and the patient is lying on a supine position, of course we know for sure that there is tendency for pressure sore. Why? Because of the fact that the patient is going to be seen resting on areas that are prone to pressure sore. So you need to ensure you monitor, reposition the patient regularly to avoid pressure sore. Now, the next thing we want to talk about then is, let's move on to the next position, which is referred to as the prone position. What is prone? The patient lies flat on their stomach with the head turned to one side. Prone simply means that the patient lies flat on their stomach with the head turned to one side. That is prone. What are the indications for prone? Prone position increases oxygen circulation or improve oxygenation rather in patients with acute respiratory distress syndrome. Prone position improve oxygenation in patients with acute respiratory distress syndrome. Now, it also used for postural drainage. It is used for postural drainage, and of course, it also helps to relieve pressure on the back. So those are some of the indications for prone position. Now, what are the precautions we need to look out for when it comes to prone position? Now, number one is you must ensure airway patency. You must ensure airway patency. This position avoid in patients with spinal injury. This position, any patient that have spinal injury, such patients should avoid this positioning. So regular monitoring of the skin is also very important. You must regularly monitor the skin integrity. Why are you monitoring the skin? To prevent pressure sore or to prevent bed sore. Now, the next thing we want to talk about is lateral position, side lying of the patient. So side lying of the patient simply means the patient lie on their side with the top leg flexed and supported. Top leg flexed and supported. Now, if you look at the screen, you're going to see we have different types of lateral position. So we usually call it lateral recumbent position. So we have two types of lateral position. We have the right lateral position. We have left lateral position. Like I said, we call them lateral recumbent position. What have I said? Types of lateral position. So let's move and talk about the specific types of lateral position. So what is so unique about the right lateral position? Now, the right lateral position promotes gastric emptying. Now, these are things that I'm going to test for. What is lateral position? What is it meant for? Right lateral. The one basic thing I'm going to test for is that the right lateral is basically, rather, one of the biggest or one of the quickest thing that testing for is that lateral recumbent position help in gastric emptying. So that is one thing we must understand. Now, the next question is, what is so unique about left lateral? That's left lateral recumbent. What is so unique about it? Now, the left lateral recumbent position promotes increase in blood circulation to the placenta. So basically, is more used in pregnancy. So when you go to see questions, going to test you for recumbent left. A woman who is pregnant is going to be placed in what position? So when you see pregnancy, one major area or one major position that the woman is pregnant is placed on is what we call the left lateral recumbent position. So those are the things I want us to remember. Right is for gastric emptying, left is for pregnancy. That is it promotes flow of blood to the placenta. Now let's talk about the next one called the Fowler's position. Fowler's position. What is Fowler's? Fowler's position is when a patient is seated with the head of the bed elevated at varying degree. Fowler's position simply means when the patient is seated with the head of the bed elevated at varying degree. So it therefore means that we have different types of Fowler's position. That's to say, when the patient is sitting, however, the head of the bed is elevated to a certain degree. So the degree to which the patient head of bed is elevated determines the type of Fowler's position. Hence, we have low Fowler's position, semi-Fowler's position, and high Fowler's position. So when you say low Fowler's position, what are we talking about? We're talking about when the head of the bed is elevated between 15 to 30 degrees. When the head of the bed is elevated between 15 to 30 degrees, referred to as low Fowler's position. What if it's elevated between 30 to 45 degrees? Is referred to as semi-Fowler's position. What if it's elevated between 60 to 90? Is referred to as high Fowler's position. I repeat, the level of elevation of the bed determines the type of Fowler's position. Low Fowler's between 15 to 30, high semi-Fowler's between 30 to 45, and then high Fowler's between 60 to 90. So then let's move on to talk about the next thing called the indication. What are the indications for high Fowler's position? Now, there's always an acronym called the rodent. Now, one of the indications for high Fowler's position is to reduce aspiration risk. Of course, when the head of the bed is elevated at angle 90, it means that aspiration has been reduced. Now, it is also used for oral intake, that is eating and swallowing. It facilitates feeding and swallowing. It also used for defecation. It also promotes easy breathing. Of course, it also used for NG tube placement. And of course, it's also used for taking X-ray. So these are some of the indications for high Fowler's position. Okay, so the next position we'll be talking about is the Trendelenburg position. Talking about the Trendelenburg position. So when you say Trendelenburg position, what are we referring to? Now, Trendelenburg is a position whereby the patient lies flat with the head lower than the feet. Trendelenburg position is a position whereby the patient lies flat with the head lower than the feet. That is what it means. Now, what are the indications for this kind of position whereby the head is lower than the feet? Number one, it is used for management of shock. It is used for venous return improvement. If we need to increase venous return from the lower extremities, Trendelenburg position becomes one of the positions that is used to do that. Next is used for certain surgical procedure. However, there are precautions we must apply when using this kind of position. But one among them, this position is avoided in patients with increased intracranial pressure. Because remember we said that it promotes use for shock management. That's to say, quick blood flow to the head. So it therefore means that if a patient have increased intracranial pressure, such positions should be avoided. Now, you must also ensure you monitor the patient for respiratory distress. The reverse part of it is, reverse Trendelenburg position is the position whereby the patient lies flat with the head higher than the feet. reverse of it. So the question then is, what are the indications why the head will not have the reverse part of it? Reverse Trendelenburg position number one. One of the indications for reverse is that it reduces aspiration risk. It reduces aspiration risk during feeding. So which means that if a patient want to feed, though we can use this position, however, one of the indications is that it reduces aspiration during feeding. Two, promote venous drainage from the head. The same way we have the Trendelenburg whereby it is used to increase venous return. So also if we have too much pressure on the brain, if we need to reduce pressure, reverse becomes the position that is used so as to drain or to promote venous return from the head. Now, it's also used for upper abdominal surgery. This position is also used for upper abdominal surgery. Now, what are the precautions we need to look out for such a condition? Number one, secure the patient to prevent sliding. Of course, this position can lead to sliding of the patient, so you must ensure you secure the patient properly so as to prevent sliding, because patient safety is a key. Now, you must also ensure you monitor the patient for hypotension. Ensure you monitor the patient for hypotension. So these are some of the indications for that. So the next position we'll talk about is the Sims position. The Sims position. What is Sims position? Is referred to as semi-prone position. Sims position is also referred to as semi-prone position. Remember, we say prone is when you lie facing down with the stomach. So a semi-prone position where the patient lie on the left side with the right knee and thigh drawn up. I said a Sims position is where the patient lie on the left side with the right knee and thigh drawn up. So the question is, what then are the indications for this position? Remember, we say it's referred to as semi-prone. So what are the indications? Number one is this position is used for rectal examination and enema. If we need to administer enema or we need to do rectal examination, this position is one of the best positions that is used for that. Then it's also used to relieve pressure from the sacrum and the heel. It is used to relieve pressure from the sacrum and the heel. Now, what are the precautions we need to look at? For number one, support the upper shoulder and hip with pillow. You must be able to support the upper shoulder and the hip with pillow. Next, you must avoid prolonged position to prevent nerve damage, because this position can lead to nerve damage, so you must avoid prolonged positioning to prevent nerve damage. Okay, so the next position we'll talk about is lithotomy position. The lithotomy position. So when I say lithotomy position, what are we referring to? This is a position whereby the patient lie on their back with the leg raised and supported in syrup. So when the patient lie on their back with the leg raised and supported, and then the strap are used so as to hold the legs in position. So when the patient is lying like that, referred to as lithotomy position. Now the question is, what do we use this position for? What do we use this position for? Now, majorly this position is used for gynecological or oncological procedure, usually for gynae use. We want to examine a woman and all of that, rectal procedure and all of that. We use lithotomy position. Now, it's also used for childbirth or childbearing. During labor, the woman need to examine the woman. You use lithotomy position. Now, what are the precautions we need to look at for while using this procedure or this position? Number one, you must avoid nerve compress in the legs. You must avoid nerve compression in the legs. Two, you must ensure proper positioning of syrup to prevent injury. That's to say, whatever you use to support the legs, called the syrup, you must be placed properly to prevent injury. So that is for that. So the next we'll talk about is the knee chest position. The knee chest position. So when you say knee chest position, we're talking about a position whereby the patient rests on their knee and chest. The patient rests on their knee and chest with the head turned to one side. Knee chest position in the position whereby the patient rests on their knee and chest with the head turned to one side. Knee chest position. Now, when do we need knee chest position? Where do we use it? What are the indications for it? This position is used for rectal examination. It's also used to relieve pressure from the lower back. It's also used to relieve pressure from the lower back. It's also used to relieve pressure on prolapsed umbilical cord. So if there is pressure, if there is prolapse of the umbilical cord, if there's pressure on the umbilical cord, one of the measures to relieve pressure is knee-chest position. Now, the next thing is the precaution. What are the things you must watch out for while doing this position? Number one, you must monitor for dizziness. Monitor for dizziness. You must avoid prolonged positioning. You must avoid prolonged position. But one major tool we must look out for is that knee-chest position help to relieve pressure from prolapsed umbilical cord. So that's an area I want us to look out for. So let's move on. Okay, so the next position we'll talk about is the tripod position, also called the orthopneic position. Orthopneic position, also referred to as the tripod position. Orthopneic position. So this tripod position, the patient sits up and lean forward with arm supported. The patient sits up and lean forward with the arm supported. We call it the tripod position. Now, why tripod position? What do we use tripod position for? Now, tripod position, number one major thing we use tripod position is for it facilitates breathing patient with. It facilitates breathing with patient with COPD. Patient with COPD, it facilitates breathing, and then it enhances chest expansion. It enhances chest expansion. Tripod position. Now, the next thing is, what are the precautions we need to observe? What are the precautions we need to observe while attending or placing patient in the tripod position or the orthopneic position? Now, one major thing we must observe is that monitor for fatigue. Of course, the patient will be tired, so you must monitor the patient for fatigue. Ensure arms are properly supported. Arms are properly supported by pillow or whatever thing you need to use to support the patient. Now, the next thing we want to talk about then is, how then do I use this position? How do I attempt question using this different positioning that we've just highlighted? Now, one thing we must understand is that in answering questions when it comes to positioning, three things we need to ask ourselves. Number one, what is the goal? What do I need to? What am I trying to accomplish with this position? If you know what you are trying to achieve with this position, it will help you to know where you are going to. So, what is the goal? Number two, how does this position affect the client anatomy and physiology? This positioning, how does this position affect the client anatomy and physiology? If we know how this position affects the anatomy and physiology of the patient, the next question is, which position affect the client anatomy and physiology to accomplish the goal? Remember, we said the first thing is the goal. What am I trying to accomplish with this position? If we know what we tend to achieve with this position, the last question is, which position affect the client anatomy and physiology to accomplish this goal? So, ability to understand these three steps will help us to know how to use any question, use any position to answer any question. I repeat, first, what is the goal? Two, what is the anatomy and physiology? Three, what is the relationship between the anatomy and physiology and the goal? So marrying all of this together will help us to know how to answer such a question. Okay, so let's move and take one of the first example we'll talk about. Let's move and talk about the first example. So, like I said, we have understanding this, the rules will help us to know exactly what we are looking at for. So, the first example we're talking about is, let's talk about embolism, pulmonary embolism, pulmonary embolism. So, when I say pulmonary embolism, following the three steps we need to follow, the first question is, what is my goal? What is my goal in pulmonary embolism? The next question is, after knowing my goal, the next thing is, what do I need to achieve? What is the A and P of this position, and what do I need to achieve? What position do I need to place in? So, talking about pulmonary embolism, let's talk about use pulmonary embolism as the first example. Now, we know for sure that in pulmonary embolism, there is an embolus. There is an obstruction in the movement of air. So, what is the goal of when a patient comes with pulmonary embolism? What is the goal? The goal is to increase oxygen to the lungs. The goal is to increase oxygen to the lungs. That is the goal of pulmonary embolism. Two, so if we have the goal as to increase oxygen, because we know for sure that increase oxygen to the lung will help the patient to breathe. Goal. Now, how do this position affect the client anatomy and physiology? If I place the patient, how will this position affect ability to breathe, increase in oxygen to the lungs and ability to breathe? We know for sure that the higher the client is, the higher the position the patient is placed, the more the room the lung have to expand. And when the lung have the ability to expand more, they're going to be increased oxygen to the lungs, thereby helping him to have more oxygen in circulation. Now the question is, which position affect the client anatomy and physiology to accomplish this goal? What is the goal? Increase oxygen to the lungs. Of course, it's high phallus position, because in high phallus position, the patient is sitting upright angle 90. When the patient sits upright angle 90, it promotes expansion of the lungs and more oxygen to the lungs. So that is for that pulmonary embolism. So let's move on, use another example, and this time we're talking about air embolism. Okay, so let's move to the second example. Let's assume we need to attend to a patient with air embolism. So what position do we place a patient with air embolism using these rules like we explained? Talking about the goal. After the goal, we talked about the anatomical relationship and then the position. How does the positioning affect the anatomy so as to achieve the goal? Now, when you talk about air embolism, simply means when we have trapped air within the bloodstream. Trapped air within the bloodstream is also referred to as gas embolism. Imagine when you are giving IV and then air bubble goes into the bloodstream via IV line and all of that. So that situation is a serious condition that needs to be attended to. So when the patient have air bubble within the bloodstream, which position do we place him? That the first question is, what is the goal of treatment? The goal is to trap the air, this bubble within the right ventricle. The goal is to trap the air within the right ventricle. That's to say, we need to ensure these bubbles are not trapped within the lungs. Instead, they are trapped within the ventricle. So that is the aim. So the question then is, which position do we need to place this patient so as to promote the movement of the gases or the gas to the right ventricle for it to be trapped there? Now, in this condition, discover that left lateral Trendelenburg position become the best option. Left lateral Trendelenburg position becomes the best position. Remember we talked about that Trendelenburg as a position whereby the head is low and the feet is elevated. And of course, we said all of that. One of the reason why we do that is to promote venous return. So when you place the patient in this position, you are promoting venous return. However, another thing again is that it will help to move the bubble from the extremities or wherever they are found. It will move them from or prevent them from being lodged within the lungs while it stays in the heart. Which part of the heart? The right ventricle. So for air embolism, the best position is left lateral Trendelenburg position. So that is how we do that. So let's now move on to talk about post-liver biopsy. In post-liver biopsy, now you got to ask yourself, the liver, which position do we have the liver? Of course, we know that the liver extends from the right hypochondria through the epigastric to the left hypochondria. The liver is more from the right hypochondria through the epigastric to the left hypochondria. So when you say liver biopsy, simply means tissue have been taken from the liver. If tissue have been taken from the liver for test, what position should the patient be placed after tissue had been taken That is the question. Now, where do we have the liver more? We have the liver more at the right. So it therefore means that post-op liver biopsy, the patient should be placed on the right side, not left side. Why right side? So that two things are involved. One, if we need to drain. Two, for pressure. Pressure can lead to, when you lie on the right side, pressure on the affected part could bring about, it could reduce bleeding, and then coagulation can occur. But if at all there is bleeding, it promotes drainage. So that is why post-op liver biopsy, the patient is placed on the right. So let's now talk about the cleft palate. Cleft palate. Under cleft palate, two things: we have cleft lift and we have palate. So it therefore means that when a patient having cleft palate, when it is for feeding, patient should be on upright, should be in upright position for feeding. But for post-op, patient should be on prone. Post-op, patient should be on prone. However, two things are involved. Now, for feeding, the patient should be upright. Two, we now have for palate, post-op. For palate, patient should be on prone. Remember we said prone. Under prone, we said it promotes drainage. So under prone, you use prone for drainage. So that is for that. So if cleft lift, patient cannot be on prone. But for palate, the patient should be on prone. So that is for that. What have I said? Cleft palate. Under cleft palate, what do we do? Cleft palate, if it is for feeding, cleft palate, if it is for feeding, the patient should be on upright position. Upright position for feeding. But if it is for post-op, the patient should be on prone. The patient should be on prone for post-op. But for feeding, the patient should be on upright. Now, after knowing all of this, let's dive into our question and see if we can answer the question based on the positioning we have studied. The nurse attending to a post-op liver biopsy patient is expected to place the patient in what position? What is it? Post-op liver biopsy. Remember we said the liver is found at the right. So what position should we place the patient after post-op liver biopsy? A, left lateral. Is that the right position? Let's hold on. 2, right lateral. Is that the right position? 2. C says supine position. D say prone position. Like we say in our teaching, we said prone. Liver is found at the right. So post-op liver patient should be placed on the right lateral. Right lateral. So number 1, the answer to number 1 is B. So let's move on to number 2 question. The supervisor knows the nurse understand positioning when she placed the patient with diagnosis of air embolism in what position? Number 1, left lateral. 2, left lateral Trendelenburg position. Number 3, we have right lateral Trendelenburg position, and then we have supine position, and then semi-Fowler's position. Now, what is air embolism? In air embolism, the goal of air embolism is to prevent air from lodging in the lungs. Prevent air from lodging in the lungs. That is the goal. So it therefore means that the patient should be placed on the head facing down. Trendelenburg position, the head facing down. However, it should be on either right or left. So what position are we taking? The patient should be on the left lateral. The patient should be on the left lateral Trendelenburg position. That is the position that is used to prevent lodging of air in the lungs, even though it's in the heart. So that is for that. So number 2, the right option is A, left lateral Trendelenburg position. So let's move on to number 3. What position is the nurse expected to place the patient with cleft palate during feeding? During feeding, what position is the nurse expected to place the patient with the left cleft palate during feeding? Now, remember we said among the position we talked about, number 1, A, left lateral. Is that the best position for feeding? Let's hold on. 2, upright position. Is that the best position? 3, right lateral. D, prone position. So what position is best during feeding? So the best position during feeding is not left lateral, is not right lateral, is not prone position, but upright position. So that is B. Upright position becomes the best option. Now let's move on to talk about the next one called number 4. What position is the nurse expected to place the patient with cleft palate after surgery? After surgery. A. Left lateral. B. Upright position. C. Right lateral. And then D. Prone position. Now if we talk about cleft palate after surgery, remember we said as part of the position we talked about, is left lateral the best position after surgery? Cleft palate? Of course not. Upright position? No. Right lateral? No. The best option is prone. Why prone? For drainage. Prone is used for drainage. So that is for that on this question. So number 1 option is left lateral. Number 2 question is left lateral. Number 3 question is upright position, and number which is B, and then number 4 question which is D, prone position. So those are the answers to this question. So I'm going to pause it here and drop some other question. I want you to look at them, analyze them, drop your answer in the comment section. Let's see the review, and if you understand, if at all you understand this question. Kindly share, like, and subscribe if you are new here. Let your friends know what's happening here. Thank you, and God bless you.